Hey guys, welcome to my channel once again. My name is Omobeejay, and in today's video we'll be going through the evaluation station of the Midwifery OSCE. We already know that the evaluation station is the fourth part of the nursing process, the first three being assessment, planning, implementation, and finally the evaluation. That's the point where you get to evaluate the care of this woman. And like we've mentioned in the previous videos, there are link stations, the assessment links into the planning and into the implementation and into the evaluation. So say for instance, if you had like a labor and birth scenario, the assessment, you assess all of that, the planning, you've planned, implementation, she probably was nauseous and then you had to administer some anti-sickness for her, or it could be anything at all. The evaluation station, you could have it that, oh, she's had a baby now, her baby was this and this, that and that, and now she needs to be discharged home or discharged into the community. So evaluate her care and then hand over to the next team. So basically that is what the evaluation station is about. So if this is the first video you're seeing, I hope you find value in the video. Yeah, but there are also other videos, other skill stations. Link to the playlist is going to be in my description, which I know you would also find value in. And if you're a returning subscriber to those videos, I hope you've been finding value in the Midwifery OSCE videos. Don't forget to subscribe, like, and share to as many other people you think might also benefit from the videos. So without wasting so much time, we're just gonna go right into it. The evaluation station is a pretty straightforward one. So major things to note about this evaluation station is it's a verbal station, so you'll be marked based on what you say. You have a document to write a couple of things on, but you will see right here it says candidate notes. This documentation is for your use and it is not marked. So whatever you write on this paper, it really does not matter. The most important thing is what you say. So if it depends on how you are and how quick and how much you're able to retain information, you might choose to use the sheets and you might choose not to. You might just as long as you know what you're saying and you're able to put all the information together quickly and do a quick handover on it. But if not, just a quick, just bullet points of things you want to say, so that you don't waste so much time writing on here and then it's not marked and you don't have adequate time to do a verbal handover. I don't know if you get what I mean. So that is one thing to bear in mind for this station. So we'll just go through each of the scenarios: the antenatal, postnatal, and the labor scenario. So for the antenatal, it says state the woman's name, hospital number, and or date of birth. So of course that's in the beginning. And yeah, for this handover you'll be using the SBAR approach as well. So the situation goes on: I am Bolaji, the midwife who looked after Amy Hall. Date of birth, something, hospital number, something. So basically that is that first point done. Then the other thing is state reason for handover. So I'm handing Amy Hall over. I looked after Amy Hall and I'm handing her over now because she no longer requires this care at this time. She presented with something, then that links into the background. She presented with vaginal bleed at term, and then she's had so you just give us a history of everything that has happened, the assessments, the previous medical history, the obstetric history, the relevant allergies, the medication, the social history. Then you would outline all of those things in your background. So for this one, I would like to mention here, while you would do an assessment, like when you do the assessment station, for the information, the assessment you'll be handing over in this station is going to be the assessment that they provide to you in this station. Okay, yeah, so this is the paperwork and the briefing. So for evaluation, you are a midwife now working on the antenatal ward. Amy Hall has had an uneventful night on the antenatal ward. She has not experienced any further vaginal blood loss overnight and her abdominal pain has settled now. You've carried out an antenatal assessment of Amy this morning. The CTG was assessed and was also carried out to assess fetal well-being, and both assessments were reassuring. Dr. Gupta has also reviewed Amy this morning and has discharged Amy back to midwifery-led care in the community. You are required to provide a verbal handover to ensure that the community midwife has a full and accurate account of Amy's history and ongoing care needs. So assessments in your evaluation station is going to be based on the information they provide on this page. This briefing, this evaluation briefing is going to be based on this information and not on the assessments that you did before. That assessment that you did before is for your planning station. I don't know if you get what I mean. So you'll be using the SBAR tool to do a verbal handover. Outlines findings provided from the most recent assessment. You can see what it says on the most recent assessment. That's the assessment that was documented on your paperwork. Outline current event findings from the most recent assessment. Outline all care and medical interventions completed. So what did they do to this woman? In the case of Amy, does it say anything? Let's check what was done for her. In the case of Amy, they've said you carried out an antenatal assessment on her this morning. A CTG was also done. They haven't said they did any medical intervention or procedure for her, but if there is, you have to outline it. Using the SBAR tool to verbally hand over to the examiner, states what is required of the person taking over, and proposes a realistic plan of action. So this point right here is where I would say the most of the work is. Verbal communication is clear and appropriate. Acts throughout in accordance with values and requirements of the NMC. So states what is required of the person that is taking over and proposes a realistic plan of action. So one approach for me that I've used is that, so I am the midwife accepting this patient now, this woman now. What information do you think I would need to know? You as a midwife, somebody is handing somebody over to you. What information do you think you want to know? Those are the kind of information you provide. So in the case of Amy now, she has been discharged back to midwifery-led care. She's term already. So what do you think would be happening to her? So you want to teach her, part of the recommendations you want to teach her to watch out for signs of labor. You want to tell her to look out for show. You want to tell her to continue to be midwifery-led care, go for her appointments when required. And because she's term already, if she doesn't fall in labor, you want to tell the community midwife to consider induction of labor if she has not fallen in labor at 40 weeks. You want to tell her to continue to monitor the fetal movements. And if anything changes, you want to tell her to come into the hospital as soon as possible. You want to tell the midwife that they should continue midwifery-led care, continue to monitor continue maternal and fetal assessment as normal. You want to tell the woman to continue to drink well, fluid hydration, and then she should open her bladder and bowel. She should eat fiber diet, encourage mobilization, encourage her to eat and drink well, and general advice. So you have to also propose like a realistic plan of care for this woman. So that's for if it was vaginal bleed at time. But if it was preeclampsia, ensure low salt diet, stay in a low lighted room, and all of that. So some of the recommendations you used in your planning station would also come to play in this station. I don't know if you get what I mean. So basically that is pretty much the evaluation station in an antenatal scenario. So for the labor and birth, state the woman's name, hospital number, and or date of birth. Is still the same thing. I am Bolaji, the midwife who looked after Amy Hall. Date of birth 1st January 1970, and hospital number 1234567. It is as simple as that. State reason for handover. I'm handing Amy Hall over because she no longer requires the care at this time. She presented with so and so, and now she's so and so, and now we are discharging her. So states the reason of the date of admission. She presented with so on so at so time. the date of admission, the visit, the reason for initial admission or referral to specialist team, and diagnosis. You want to mention what the diagnosis, differential diagnosis was. Note previous medical history, obstetric history, and relevant medication history and social history. So you don't want to forget to mention the allergies. Is she on any regular medications? You want to know that. Outlines recent events. Again, recent events. So it's going to be just the events that was on that last page, the evaluation scenario briefing that they give you, not the previous assessment though. So outlines recent events and details the findings provided from the most recent assessment. Outlines care and medical interventions completed. So in this one, you want to tell us whether she had amniotomy performed, how did her labor go, did they require any interventions, like things like that are things you want to mention here. States areas of concern for maternal well-being. So it's possible that the scenario you get, you might have some areas of concern for maternal well-being. They want to see your ability to bring out such information and be able to hand it over to the next midwife. So you use the SBAR tool to hand over the information verbally to your examiner. So like I said earlier, this scenario, your documentation is for you. It is the verbal handover that you'll be marked on. States what is required of the person taking over and proposes a realistic plan of action. So this is a woman that just had a baby. What realistic plan of action do you want to tell her? So you let her know that there will still be continuity of care even as she goes home to the midwife. They would still come to see her day 3, day 5, and then she'll be discharged back after about 2 weeks. They'll still monitor if she has a cesarean section. You want to tell her care of her cesarean section of the wound site. You want to encourage her to be performing Kegel exercises. You want to encourage her to mobilize. You want to encourage her to use her TED stockings if she has one, or any other anti-embolic agents that she has. You want to encourage her to correct attachment and positioning if she chooses to breastfeed. You want to teach her 1 or 2 things on how to care for her baby. You want to tell her to monitor localia, because I mean at this point she's most likely postnatal already. So those are things you want to mention. You want to propose a realistic plan of action. So verbal communication is clear and appropriate, acts throughout in accordance with the values and requirements of the NMC, the code, professional standards of practice, and behavior for nurses and midwives and nursing associates. And that's pretty much your evaluation station. So it's more of the verbal handover. Don't spend too much time writing on the paper. What you say is what really matters, just bullet points. And if you think you don't even need the bullet points, you really don't have to write anything down. If you think you'll be able to like get the information from here and there just by glancing through the briefing that you have been provided with. I hope this helps. If there's any other thing, I would write it or leave it as a comment in my comment section. And lastly, postnatal scenario. So for the postnatal scenario, it says states the woman's name, hospital number, and or date of birth and discharge address. So because this is postnatal, you want to also state her discharge address. Where does she live normally? So don't forget that. States the reason for handover. She presented with, or you went into her at day 2, day 5, day 10, and then you saw she had mastitis, she had feeding issues, and that has been resolved now. So we are handing over. Outline recent events and detailed findings from assessment. So findings from that last assessment that you did. Outlines care and medical interventions completed. Did she have MSU done? Did she have those are things you want to mention there. States areas of concern for maternal well-being. Are there still any areas that we are still concerned about? In this case, you want to mention that. Uses SBAR tool to hand over information verbally to the examiner. States what is required of the person taking over and proposes a realistic plan. So you want to tell the woman, okay, this woman had feeding issues. Do they want to refer to the health visitors so they can check in on her from time to time to see if she's she's happy with breastfeeding now. Is she attaching currently? How is the baby? Is the baby's weight improving since she's been breastfeeding? Those are things you want to do. Perineal infection, is infection still there? How is she taking care of her perineum? Is she performing Kegel exercises? Does she have the is she showing any signs of DVT? How is her emotional well-being? So those are things that you want to hand over to the woman, and then also propose a realistic care plan for the person taking over. So verbal communication is clear and appropriate, acts throughout in accordance with the values and requirements of the NMC, and that's pretty much the evaluation station. So evaluation station is usually pretty straightforward most of the time, and I don't think I've seen anybody fail this station, to be fair. So I think it's one of the easy ones. If you have any questions or anything you want me to clarify, feel free to ask me in the comment section, and so we can keep it going. If you would like someone to practice with you for your exams, I offer practice sessions, paid sessions anyway. For a token, you can always reach out to me via email on omobeejayvlogs@gmail.com or businesswithomobeejay@gmail.com, and then we can arrange something. If you've not subscribed yet, now is the time to subscribe. If you've not liked, now is the time to like. If you've not shared, now is the time to share, because sharing is caring. Yeah. Till you see me in my next video, I wish you all the best in your exam as you prepare. I just got to help you to focus on the right things, and I pray that you find favor in your exam and it all is going to go well for you in Jesus' name. So you see me again in my next video. I remain your darling Omobeejay. Remain in God, and God bless you. Bye.